Hey everyone, Nurse Terry here, and today's Test Tip Tuesday is all about red flag labs. So when we see exam questions and labs show up, we see a whole bunch of numbers, but they're more than numbers, they're really clues. Remember Blue's Clues, everyone? Yeah, so these clues totally change the way you look at a test question, and it shows you exactly what you should be focusing in on. The red flags show you exactly what you should be focusing in on. Let's start out with looking at sodium levels. So if sodium drops below 120, that is a sign that there's going to probably be an acute neuro problem. And so you're going to be looking for things in the question that have to do with confusion or instability, forgetfulness, something that just doesn't seem right. And so what do you think that's going to equate to in a question? It's going to have to do with safety and monitoring. So don't look at the whole question, zone in on that red flag lab, that red flag low sodium, and think about safety and monitoring first. And our next big red flag lab is potassium. It doesn't matter if it's too high or too low. Whenever that potassium is out of whack, what does it mean? Cardiac arrhythmias. So you are going to definitely be zoning in on a cardiac problem. You need the EKGs going. Maybe you need to get an echo or blood pressure checks to see how the heart is pumping properly. But you're going to zone in on arrhythmias. And what comes after arrhythmias? Cardiac arrest. So you don't want to be blowing that one by. Definitely take a look at those red flag cardiac levels. And our third area that we want to look at this morning is WBCs. When they are too low, you have an immunocompromised patient. And what does that mean? We're going to look at infection risks. So look at that question and zone in on what might be an infection risk. Did people wash their hands properly? Did they sneeze all over the place without sneezing in their elbow? So you want to look at things that might cause somebody to get sick. So don't let those red flag labs fly right by you. Zone in on sodium, potassium, and WBCs, which are the three top things that you're going to see on nursing questions, and look for those clues so you can figure out the right way to go with that question. Take care, you got this.